Alright, next we're going to go into a bit more detail into open heart surgery, or the median sternotomy, that's usually used to access the heart for things like bypass surgery or valve repairs or replacements. So this is when there's a surgical division, so the surgeon will cut through the sternum or your breastbone. So a sternotomy can be a full sternotomy, so the full length of your sternum, which is usually about 20 to 25 centimetres, or it can be a partial, where it's the top third of your sternum is surgically cut, and it's about 10 to 13 centimetres. So post-operative complications may include sternal instability, so restricted range of movement and pain around the site of the joint afterwards. Also wound and scar care. So we're going to go into each of these aspects now. So post-operative physiotherapy is recommended to determine your appropriate lung or respiratory interventions and to help improve your breathing or your ventilation. This will then also help with your functional recovery and get you mobilising earlier. So they like to get you out of bed fairly fast, get you sitting upright, getting you taking deep breaths soon after your surgery. They usually also use a positive expiratory pressure device, or a PEP device, which is where you blow out into this device and it's to train your muscles back in. So you would have been put on a heart and lung machine during your surgery, so this is just to try and wake everything up and get everything moving again and functioning as it should. These devices also help to improve your early post-operative functional capacity after surgery. Approximately 30% of cardiac surgery patients, so about 1 in 3, will experience some sort of musculoskeletal complications that involve the shoulders, the chest and the arms. So post-sternotomy pain may significantly interfere with your comfort, function and sleep. It is somewhat expected. It's a big surgery to go through, so there are some tips that we'll go through in a moment on how to minimise any pain or dysfunction associated with the sternotomy process itself. If you had your internal mammary artery grafted, so taken from, it's usually in this middle third section of your arm and chest, and used it as a graft, there's a 38.5% chance that you will experience some sort of shooting or intermittent pain in the anterior chest wall on that side. So it's, I wouldn't say 38.5% is uncommon, but it is something to be aware of. It is related and a somewhat expected side effect of using that grafting site. But you may also experience tenderness, numbness or increased sensitivity anywhere across your chest and rib cage, and also near the grafting donor site. So whether that came from your arm or somewhere in your chest or in your legs, it can take a while. It is another wound for you to be aware of, to care about in your recovery process. Following an open heart surgical procedure, you should take your pain medicines as described. It is a normal part of your recovery to experience some pain and discomfort for up to 6 to 9 weeks post-surgery. Again, it is a really big surgery. Be kind to yourself in these early stages. You can also relieve pain with warm showers, heat packs or ice packs as well. Make sure you undertake your shoulder, neck and back exercises to reduce chest pain and discomfort, as well as trying to keep that function and mobility going. So we do have separate videos for both the early and late stages. So the first 4 weeks we've got a video of the stretches and movements that you should be doing on a daily basis, and then we've got another video for you 4 to 12 weeks post-surgery that's a little bit more advanced as well. So again, you should be doing those on a daily basis, and this will help improve your pain and function after your open heart surgery. Consult with your doctor or other healthcare professional if you develop any symptoms, or if anything is persisting longer than you think it should be, or if it's starting to interfere with your daily tasks. And remember, listen to your body. This will help you set safe limits for your activities. Some people recover a lot faster than others, so again, listen to your body. It's the best predictor of how far you can push yourself on a day-to-day basis.